I'm Dr. Swati, and today we will be discussing one case of patient, 6-year-old patient boy, and he is having jaundice. Now, treating physician is suspecting hepatitis, but what sort of hepatitis and how to proceed further for the testing? Let's discuss a bit. It will be very easy. It will be a very easy lecture. It's an easy lecture because we won't get into the details of it. Just the blood test part and how to interpret those results. That's it. So as you can see that through bilirubin, we can easily conclude that patient is having jaundice, मतलब पीलिया. Now, what kind of jaundice? Let's find it out. SGOT, SGPT is raised, but ALP is normal for the age. So when we have SGOT and SGPT raised, then we should think about hepatitis. And because we are dealing with a kid here, we should not focus too much on B and C, rather A and E. Why? Because B and C is still coming under sexually transmitted disease, which is highly unlikely in this patient because of the age. But A and E can be transmitted through dirty food, dirty water, poor sanitation conditions, and even when patient is eating outside. So it's most likely that patient of 6-year-old age will be eating outside without washing his hands, and maybe he's going to school sharing tiffins, and maybe eating with dirty hands after playing. So we should focus on A and E. So what are the tests? Let's talk about B and C as well, but first let's focus on A and E, which is very important in this. A, we'll go for HAV antibody, and for E, we'll go for HAV antibody. Both are done by ELISA method, and they are very important when LFT is deranged, as in this case. But I would say that SGOT and SGPT is not that increased. It's all right. But I was expecting more than 1,000. But I'm figuring it out that maybe after 6 or 7 days, maybe in 2 3 days, 48 hours, 72 hours, it will reach 1,000, because patient has just come to the clinic. So maybe this is the baseline value we are starting with. Infection has just started, but yes, it will go up more than like 1,000. Then only we will be very sure that okay, we are dealing with viral hepatitis. So HAV antibody and HEV antibody and repeat LHT after 48 to 72 hours. For B and C, HBsAg and HCV antibody only if mother is positive. Then we can still say that okay, maybe it was transmitted during the birth and now it's getting diagnosed, or maybe clinical picture has come now, is apparent now, and he was hepatitis B or hepatitis C positive all along. But most likely we are dealing with A and E and not B and C, which is coming under STD panel.